Welcome to the Teaching Value in Healthcare Learning Network. Each month we get to come together with leaders in the healthcare field to share practical and tangible advice about how to develop engaging curriculum and health system innovation centered around healthcare value. I'm Chris Moriates, Assistant Dean for Healthcare Value at Dell Medical School, University of Texas in Austin, a hospital medicine physician, and the Director of Implementation for Cost of Care, and I'll be moderating today's webinar. Today we're honored to have Dr. Robyn Lindner join us from Choosing Wisely Australia and NPS MedicineWise. So Dr. Lindner, listeners including myself do not know much at all at this point about medicine in Australia. Maybe you can briefly orient us and then tell us a bit about how Choosing Wisely Australia fits into that context.
Sure. Thanks, Chris. So Australia, I guess we're a much smaller country than the US. So we have a population of about 24 million people. And in terms of our health system, so we have, just in terms of the scale, I guess we have around probably about 25,000 GPs, or what you would call family physicians. And our medical colleges, I'm particularly flagging this because I guess it relates to the model of Choosing Wisely. We have around about 15, what we would officially sort of term as medical colleges, but then we have a large number of also affiliated societies and associations as well. So, for example, under our College of Royal Australasian College of Physicians, there's probably about 45 specialty societies that sit sort of within that. So that gives you a bit of a sense of sort of the size of the...
Yeah, that's really helpful. Smaller than the US, but still a very big country, 24 million people, very complex. And so Choosing Wisely Australia launched in about 2015, is that right?
That's right, yes.
And go ahead.
Oh, no, so I was going to say, yeah, so very much piggybacking off, the US and Canadian movements that had launched before that. There was a lot of interest in Australia in those movements, and that was, I guess, what precipitated us getting involved a couple of years ago.
And maybe you can explain for all of us, so this separate organization that you work with, NPS MedicineWise, helped bring in Choosing Wisely Australia, as I understand it.
Yeah, so we've talked very briefly about the Australia. So Australia has a national medicines policy that was established in 1998. And what that policy does is ensure safe access and use of medicine. So we have a Therapeutic Guidelines Association that approves access to medicines. We have a pharmaceutical and Medicare benefits scheme that funds so that there's equitable access to medicines. And then we have measures in place to make sure that we have a viable and supported pharmaceutical industry. And then underpinning all of that, NPS MedicineWise has been funded by the Commonwealth Department of Health to support quality use of medicines and tests. And so our remit is to run national programs that look to address where there's evidence practice gaps and provide education and information both to health professionals but also consumers about appropriate use of medicines and tests so that we have a viable and appropriately used health system. And so you can see from that kind of context, when Choosing Wisely launched in the US, it was something that really came across on our radar because it very much aligned with our sort of mission and objectives. And we felt that given our position in terms of our ability to run national programs, we thought we were very well suited to look at how we might be the facilitating body for Choosing Wisely in Australia.
Yeah, that's really interesting. It sounds like in a lot of ways you were already doing many of those things, but it sounds to me like found that it would be helpful to link in with this international campaign of Choosing Wisely in order to advance those goals.
Yeah, and I should add to that, I guess NPS MedicineWise, most of our work is done with general practitioners and pharmacists. Mm-hmm. So Choosing Wisely is a great opportunity for us to kind of, sort of broaden our opportunities to work with more specialists and the hospital and that sort of tertiary care sector as well. So it's an opportunity for us to broaden our reach and allow those sectors to benefit from our expertise as well.
Cool. And one of the things, one of the reasons to chat with you is I feel like it's a great opportunity for us to learn about what you all have innovated along advancing Choosing Wisely in your country. And, some of that I'm sure is context specific to sort of the differences that you've already described about Australia. But one thing I saw when I was poking around on the website earlier is that you have an upcoming national meeting on May 4th. And I just got back from Calgary, where the Choosing Wisely Canada just had their national meeting, which was just a fantastic event to see. You know, people came from all over the country, sort of all the movers and shakers in medicine in Canada were there for a whole day in working groups. And it really was remarkable. We don't yet have a central gathering like that in the United States, and you know, it could be challenging for lots of reasons, but I'd love to hear a little bit about your national meeting and how you're thinking about it and what you hope for it to accomplish and what maybe we can learn from it here in the States.
Sure. So as you mentioned, Choosing Wisely launched 2 years ago, and what we did at that launch was have a large get together where we invited all the key stakeholders, particularly health professional colleges, and had a large media event. And then last year at the 1 year anniversary, we did a similar thing where we had a big launch of a whole lot more lists and again, a lot of media. But it's really got to the point where we feel that the initiative has matured enough that we need to have a focus more now on how we take the initiative forward and what's happening around implementation and also evaluation of the initiative. And so the intention of the day is really to bring key stakeholders together from right across the spectrum. So clinicians, policymakers, payers, consumer organisations and advocates, to really hear from them about what the opportunities and challenges are going forward. So that's kind of the key objective for the day. And yeah, we're excited to see how that will go.
Yeah, and I think, you know, it's so interesting that it feels like this has been the case globally, that really the first step was raising the issue, talking about it finally in a way that people can come together and talk about it, building those coalitions. And now I think all of us are at the point where we're ready to take action and implement. And not to discount all the, you know, there's been some great implementation and stuff happening and in your country and ours and elsewhere over the past few years. But I think now is really the point where people are saying, look, the focus needs to move towards taking action, implementation. How are we really going to achieve the ideals of choosing wisely?
Yeah, and I think we feel in Australia there's kind of a nice window of opportunity where there's a degree of energy that we want to harness now. And I think to date what we've been able to show is a few people can actually achieve a lot. And so we've got some extremely engaged I guess sort of leaders in their different sectors who have really embraced choosing wisely. And so bringing opportunities to bring those people together, I think there's a fantastic opportunity to really amplify the impact that they can have. The other thing that's particular, I think, to Australia at the moment in terms of our climate is that 2 years ago, almost about a week prior to Choosing Wisely launching in Australia, there was an announcement that our Medicare benefits schedule, so all the items that are funded under our Medicare system, would be reviewed. And so that's an interesting opportunity to look at. So they're reviewing those using a model very similar to Choosing Wisely in that it's a clinician-led process where they're reviewing all those items for their evidence and looking at how they can make that system more effective and work better for clinicians and for patients. So there's a unique opportunity to look at where the opportunities to align Choosing Wisely with policy decisions as well. And so we're keen to sort of look at how we maximise those types of opportunities. And so that's some of the drivers for some of these conversations.
Yeah. And I think, you know, you mentioned that the clinician-led aspect of this seems really key. And it's interesting that, so that review of the Medicare schedule, I assume that came from the government, right? And yet they had apparently the foresight to ensure that it was clinician-led, which is, that's a lesson we can learn.
Yeah, that's right. And I think they've been watching the landscape. They were obviously familiar with Choosing Wisely in the US. They knew it was coming to Australia. And I think they were listening to what clinicians were saying and reflecting on what hasn't worked in the past to look at trying things in a different way. So yeah, it's a good outcome. It's a big challenge. It's a lot of work. But yeah, it's great to see that type of approach happening.
Great. Are there other initiatives, things you've been doing there in Australia that you want to share with us?
Yeah, so I guess there's a few things. So obviously we have colleges coming on and developing lists. We see our role then as NPS MedicineWise is very much around kind of then facilitating an ongoing dialogue with those colleges. What we found was that often those colleges, they might tend to talk to one another in formal settings, but there's not often always those opportunities to collaborate. So we have endeavoured to maintain a forum where the colleges stay in contact with one another, and that's creating opportunities to look at opportunities to work together around where they're identifying recommendations of joint interest. You know, how do they align their messaging in their guidelines and things like that? So you're reducing that ambiguity and confusion that can happen out in clinical practice. So I think that's a really positive thing, is trying to continue to encourage those relationships. We do quite a bit of work with the colleges also to think about how do you embed this into your business as usual. So trying to avoid the cut and run of doing a list and then going away and not doing anything. Yeah. So thinking about how they don't make this extra work, that's an underlying theme for us with all our stakeholders, is don't try and make Choosing Wisely a tack on. How do you embed it into everything that you're doing? So colleges...
on that point, do you have a success story or any sort of, to make this really clear for our listeners?
Yeah. So I guess what's starting to happen now is when colleges, for example, are updating their guidelines, how do they integrate their messaging into their current guidelines so that then becomes almost sort of hardwired into their sort of messaging? That's an example. Some of them are looking at how they embed it into the curriculum for exams, training modules, as an example. So those types of things to sort of hardwire, and so then it makes it easier to maintain that going forward. Also thinking about how do they make this a regular agenda item when you're having the annual scientific meetings. Like, there should be a focus on what unnecessary care is happening, and make that a regular conversation amongst your members.
Yeah.
Some of the things we're trying to, we haven't sort of achieved this yet, but starting to have conversations too with the colleges about how they teach their trainees, and this idea that most education focuses on reaching a defined diagnosis, which in many cases is not what happens in clinical practice, as we know. So helping to reframe how they think about their education to deal with uncertainty and risk and those types of things. We're just sort of starting in that area, but I think that that's a great opportunity going forward to really think about how we change the way that we train our junior doctors to make them more comfortable with that uncertainty.
Yeah, that's such an important part, or important point. I think many of us here have been, many of us in medical education have been struggling with that, and really recognizing more and more how critical that is an underlying piece to this entire puzzle, right? Is this discomfort with uncertainty and how we teach. And, I've read plenty of pieces where they talk about it's so ingrained in what we do. We take tests from from way back when that have an answer, a multiple choice answer, and then we get out in the real world and there's no multiple choice answer a lot of times. And, so we keep chasing that if just we order the right test, we will get an answer. That is I think a key component to teaching this that can't be lost amongst, lists of Choosing Wisely. So that's really great. As I'm talking to you, it's interesting. I feel like there are so many parallels. So at first I feel like the general sense was maybe amongst those not in the know that, oh, well, this is an American problem. It's because of our healthcare system. It's unique to our, to our American healthcare system. And obviously that's not true. And we've seen Choosing Wisely grow across the world because overuse really is a problem everywhere, and sort of transcends these specific systems and even, different payment models. I mean, like I said, I was just in Canada and they've got a single payer. And so it seems as though there's more alike than different. But now from your end, looking at Choosing Wisely, what are the type of things that you think are like similar lessons that we can draw out globally, and things that maybe don't translate as well away from here?
I think the similarities are, I guess there's probably some key points in terms of engaging with groups. So I think we found, and I think most people have found, you need to find those. So for example, when we first started approaching the colleges to be involved, A lot of them, they're busy. They've got so many other priorities. This isn't front and centre. And so engaging with those groups, in most cases, was enabled by finding a key champion in the organisation who might not necessarily be a CEO or the president, but it's someone who really is a passionate champion for the initiative, and working closely with them in terms of understanding how that system works and how to take things forward. I don't think that's any great revelation, but I think that it's really important to identify those people. In something like this that is really designed like a social movement, you need those champions with you. Then when you do engage with those groups, it is really important. Obviously, it's such an enabler to have that high-level executive support, both at a college level but also as a health service level, to make sure that things appropriately resourced so that they actually happen and become viable and sustainable. So I think that's been really important. For us, we found as a facilitator, the main thing that one of the best things that we can provide is an opportunity to bring people together as a network. We realise that people are so busy, they don't necessarily have time to kind of look up from their immediate workload to learn from one another. So if we can provide opportunities to share information, bring people together to communicate, that's been really powerful in terms of allowing people to get on with their job in a better way. So I think, again, I don't think any of these things are unique to Australia, but I think I've been surprised by how that has probably been the thing that we bring value to more than anything else, is that ability to bring people together. It seems so simple, but it's actually really effective. It's all about the conversation. It comes back to the conversation. This is all about promoting conversations. And so I guess what we're doing is creating a network to allow those to happen more efficiently.
Yeah, and I think that's what we have found, through all of these presentations, whether we're talking about a strictly educational curricular thing or a national implementation program like MedicineWise Australia, it really is about bringing people together, opening up that conversation, and it's been so important. So, yeah. Robyn, thank you so much for joining us. This will post on our third Thursday, although it will be Friday for you there in Australia. But thank you for connecting, and we appreciate it. For our listeners, remember to check out the Tools for Educators link off the main page, where you can find resources for the programs that we talk about on these webinars. And we invite you to join us again next month for our monthly Teaching Value in Healthcare Learning Network webinar series. So thank you, and have a good week.